The elbow joint. So the elbow is a joint that is very commonly affected with orthopedic conditions in dogs, particularly the developmental diseases which initiate and lead to osteoarthritis. As you'll remember from earlier sections, elbow pain will be associated with dogs shifting weight towards the hind limbs, away from the forelimbs. It'll be associated with a short, choppy gait. Very often with elbow pain, you'll find that the triceps tend to be atrophied. And during that first pass hands-on assessment that we talked about, you may well feel effusion and/or thickening in the elbows, alerting you to the fact that the elbows may be problematic. Now, the first assessment of the elbow we made earlier on is really important, and that's one of the first things I repeat. Assessment of whether or not there is a dip between the lateral epicondyle and the olecranon. That dip there is normal, and if there isn't a dip, then that's highly indicative of effusion or thickening of the elbow joint, which could suggest orthopedic disease of the elbow. Now, the most common orthopedic disease of the elbow is elbow dysplasia, which occurs in young dogs. And that's a composite term covering fragmented coronoid process, osteochondrosis dissecans, and other developmental abnormalities. And elbow dysplasia leads to osteoarthritis. With osteoarthritis of the elbow, flexion will be reduced. Normally, the elbow should flex to this extent, where the antebrachium touches the brachium. With osteoarthritis, there'll be reduced flexion and often an adversive response associated with that. Now, the adversive response can be quite subtle. For example, usually when I perform flexion of an arthritic elbow, all I will detect is a pulling away of this area of the dog. It's almost, in equine terms, this is called the withers, and you just see the withers kind of rise up like that a little bit as you force flex the elbow. The same with elbow extension. As you put the elbow into extension, you may find the dog will just pull away from you, pull away from that manipulation slightly. Some people like to add supination and pronation during this manipulation. So flexion of the elbow with supination, internal rotation of the distal limb, and pronation, external rotation of the distal limb. They feel it's a more complete evaluation of the elbow. Now, in young dogs with elbow dysplasia, palpation on the medial aspect of the elbow joint, just over that medial coronoid process, can elicit an adversive reaction because that's where the pathology is. And to do that, I just place my thumb on the inside of the elbow joint there, just over the medial aspect of the ulna, and apply gentle pressure.